It's been so hectic and unbelievable at the hospital. For yourself, explain your current working situation.
I've been doing this for 119 continuous days. I've been working 16 to 20 hours a day. And we have been doing that because people are coming in much sicker than what they were before. And it's very difficult to find anybody that wants to work with COVID patients. But it's a very serious situation.
What are you noticing that's different about the patients today with COVID versus earlier on?
It's interesting that you mentioned that. And what I'm seeing that is that patients are coming to me 10 times sicker than when they were before. The most important theory is that these people are waiting too long. People are scared to go to the hospital. They think they're going to die in the hospital or they're going to catch COVID. So by the time they come to me, they've had 2, 3, we had a guy that had 5 weeks of symptoms.
How much longer do you think medical institutions can continue like this and care for the numbers that we're seeing?
Well, you can't continue to do this because, remember, I believe that at some point in time, all of us are going to get corona. There is no question about it. You may have a mild form, but everybody's going to get corona. What you don't want is everybody get the corona at the same time, which is what's happening at the present time. So our healthcare systems are getting overwhelmed. Our nurses, our respiratory therapists, they're exhausted. People that normally would do 3, 4 shifts a week are doing, 2, 3 weeks continuously.
You and your staff have been working relentlessly, but you have gotten some help from the United States military. You've gotten some help from the United States military and an Army unit that has moved into the hospital there. Explain to us how many personnel and what are they doing to help support you and your staff?
That's a great question because this is my first time in my life where I actually get to work with the Army. They've been amazing. They came in 85 individuals, nurses, respiratory therapists, a few doctors. And what they're doing is we know that we're going to be getting many more patients. We know that we are going to be flooded with patients. So we allocated an entire unit for them, a unit that can host up to 50 patients.
And doctor, how did you get the unit there? How did you get the support? Did you ask for it or did someone see the great need at UMMC?
That's a question that I still can't answer. I know that a lot of it has to do with Congresswoman Sheila Jackson Lee. She made a lot of calls. She saw how we were struggling. She was trying to help out people. But I also think that we have been very transparent with the media. We have let the media come into the hospital, see what's going on. So people started to realize that we were in a crisis situation. They were seeing how even some of our own nurses were getting sick.
Doctor, what do you think it will take to turn this around?
Education. Simple as that. We can fix this. We can fix this. The way to do it is social distance, wear your mask, wash your hands. It's very simple. Closing the state without education is not going to help you. We have to educate people. People need to be socially responsible. And this is a true war. It's a war that I have against COVID and a war that I have against stupidity because people are still doing things that they shouldn't do outside. If you can convince your viewers to simply follow those easy rules that I talked to you about, we have a very good chance to flatten the curve and be okay. But if we don't do it, we're going to have a gigantic second wave in October.
How concerned are you leading into the fall? I know there's been a lot of talk in the medical community about flu season while also in the midst of a pandemic. What are your thoughts on that?
My thoughts are that a lot of people are going to die if we don't control this. A lot of people are going to die. I'm very concerned about the fall, but I think that we still have time to control that. We have a few months where if everybody does the right thing, we will be okay. But we have to do the right thing. And I apologize, I get so passionate about this, but it's a truth. I don't want more people to die. People are dying unnecessarily.